Hi, my name is Jack DeHovitz. I am a distinguished service professor in medicine and infectious diseases here at SUNY Downstate, and I direct the STAR program and have done that since its inception in the early 1990s. Well, in the late 1980s, actually 1988, we were first funded to provide a community-based HIV testing and counseling program. Our next program was actually the adolescent education program, highlighting our real focus on HIV prevention. The STAR program itself was created in the early 1990s and then grew from the AIDS Prevention Center to address research, prevention, and care. However, it's important to remember the youth program was one of the first pillars of the STAR program. When we first started with the AIDS Prevention Center and the adolescent education program, we used skits, music, and things like that. Things have changed dramatically since then, and now we reach young people through social media such as TikTok, Facebook, and Instagram. This allows us to tailor our teaching tools for the individual communities we're trying to reach. And this is very important because young people are very inquisitive about their health and the world in which they live. Well, on the one hand, COVID-19 really changed the way that we approach infections, epidemics, and how we control them. On the other hand, I'm struck by the many parallels between COVID and HIV, the same stigmatization that we see, the same misinformation. And I think programs such as the adolescent education program are so important to get the right information out there, whether it's preventing one from getting COVID or preventing one from getting HIV. One additional tool that we have in our prevention toolbox is PrEP, pre-exposure prophylaxis. This medication can reduce the risk of acquiring HIV infection by over 90%. A major focus of the STAR program and THEO is to educate folks about PrEP and how to access it. We have our own prevention outreach campaign called Get Me on PrEP and Be Healthy for You. As we go through the process of educating folks about PrEP, it's become clear that this is one of our strongest tools in ending the epidemic. Well, as we mentioned before, the STAR program provides clinical, research, and preventive services throughout Brooklyn and New York City. Our mission is really to achieve health equity through quality care, education, research, and community empowerment. The THEO program has been our major effort focusing on youth since the early 1990s and continues to provide effective adolescent education and accurate sexual health information to young people throughout New York City. STAR program staff beyond that on THEO continue to provide the THEO program with the education and the infrastructure to promote sexual health education initiatives in schools and community settings. Amazingly enough, we've reached over 20,000 young people since 1992. The program has grown immensely over the years and has impacted young people nationally and internationally. The real advantage of THEO is that its education message has evolved both in terms of content and in terms of delivery over the last 20 to 30 years. We've moved from songs and plays to really focusing intensely on social media, which has clearly improved our ability to reach the young people of our borough and our city. This generation has emerged as major change agents, whether it's rocking the vote to enhance voter registration and engagement in our political life, or whether it's focusing on the challenges with our climate. The youth have been very, very involved in this. This also includes sexual and reproductive health. Gen Z and millennials are very vocal, smart, and they really demand fairness in terms of health equity and social justice for themselves and their peers. Our job really is to help young people take on this responsibility and hold their elected officials accountable for the necessary changes both in the public square, i.e. our public schools, college campuses, as well as nationally. So I am really inspired inspire our youth and look forward to the great social change that they'll be leading.
Let's make sure that our health isn't judged or treated any differently.
Let's start to make a change.
Protect your dreams.
Let your future exist.
Let your future exist.
Teens helping each other.